Well, it's my distinct pleasure to present to you today, and I would like to thank the IARS, Smart Tots, and Dr. Sun for inviting me. I hope they won't regret it afterwards. I want to ask you a question first. Why are you all here? Why did you come to this panel here? I think it's probably the answer is just, it's the same reason why I came here, is because we're concerned. We're concerned that anesthetizing our patients, exposing them to anesthesia during a vulnerable period in their brain development will lead to long-lasting effects on their brain development and structural development. And that's why we're all here. I don't have any financial conflicts of interest, and would like to acknowledge, though, that our lab received intramural as well as extramural funding from the Massimo Foundation and from FAIR, which I'm very grateful for. And Dr. Sun stole my thunder by, presenting to you already, but most of you already know this, that there's hundreds of studies already that demonstrate that anesthetics have some form of toxic effect in the developing brain. And this has been shown for a wide variety of animal species, from chicks to non-human primates, and for all sorts of anesthetics, including inhaled anesthetics, injectable anesthetics. So what we're really faced with is that we're between a rock and a hard place. We don't want to scare parents, cause mass hysteria, and scare the parents away from getting needed treatment for their children. But on the other hand, we also don't want to miss a major pharmacological catastrophe as we did 50 years ago with the thalidomide disaster. So we're in a very tough spot here, and that's why I want to talk to you about today about some of the findings in animal research that can guide us in terms of where we should take this in clinical research. And you'll be even more confused after I'm done. What I want to talk about today is, number one, is are all anesthetics similar in terms of their toxic properties in the developing brain? And number two, is there really a safe age beyond which anesthesia is not deleterious to the brain? And number three, which are the neurological domains that should be tested in humans according to the animal data? So to address, the first is whether anesthetics are all similar. Are there any anesthetics that are devoid of neurotoxic effects? And thus far, real anesthetics have always demonstrated deleterious effects in the anesthetics, complete anesthetics. And for the sake of argument, I wanted today just compare their property of killing brain cells, so-called neuroapoptosis. This phenomenon was first demonstrated more than 15 years ago now in this seminal study here that compared multiple injections of ketamine on the right-hand side in an animal section here, and all these blackened spots here demonstrate dead or dying neurons, and compare that to the left-hand side to a control animal that was injected with a vehicle. And similar results have been found for all sorts of anesthetics. This is a non-human primate study looking into isoflurane neuroapoptotic effect. On the right-hand side, you see that newborn monkeys that were exposed to a 5-hour anesthetic with isoflurane demonstrate increased neuroapoptosis, brain cell death. And if you look closely, it's, the pattern is actually very similar to the ketamine. And when the same authors compared this to a propofol, in the middle column here, you see a propofol exposed animal, and they exposed both groups to 5 hours of the anesthetic, and they tested a response to a painful stimulus and either decreased or increased the anesthetic dose. The doses were between 300 and 400 mics per kilo per minute of propofol and 0.7 to 1.5% isoflurane. And you would think that, you know, maybe the propofol was a little bit less injurious, but keep in mind that this was only 4 animals in one group and 5 in the other. And this is just a historical comparison, that these studies were not performed simultaneously. Animals were randomized to one anesthetic or the other. It was just compared to a previous study. You can imagine that in small rodents, it's even more difficult to compare injectable anesthetics to inhaled anesthetics, because in these small rodents, there's repeated injections with, you know, ups and downs in their plasma level of the injectable anesthetic compared with an inhaled anesthetics that's applied continuously. And it's obviously very hard to compare these. And I don't know of any studies that have compared these well and have measured similar depth of anesthesia. That's why we performed a study where we compared 3 inhaled anesthetics with each other, desflurane, isoflurane, and sevoflurane. And you can see here from the sections in mice, all these light green spots are dead or dying neurons. And again, I would point out that the pattern is very similar to the isoflurane exposure in monkeys and the cell death pattern after ketamine exposure. But you can also see that the pattern and the quality, the degree of neuronal cell death are very similar. And we actually verified that these anesthetics were administered in similar doses. We, as you can see here in the upper figure, we first measured minimum alveolar concentration in all of these animals, and then applied a 0.6 MAC to these animals for 6 hours. And in the lower figures, you can see that we used 2 measures to gauge neurotoxicity. One was caspase positive cells, and the other one was an assay to measure caspase activity, and we couldn't find any differences between those 3 anesthetics. Other authors have found different results. In this study here, even though sevoflurane and isoflurane were comparable in their toxic properties, desflurane stood out to be more injurious. And the doses that the authors used were slightly different from ours, but in the ballpark. And yet a third study, isoflurane seemed much more injurious than sevoflurane. And this was administered in lower doses than what we did, but also for 6 hours. So in summary, animal studies can't really help us identify one particular anesthetic that is safer than all the others, which could be used, you know, in clinical studies as a control group, for example. Well, if that didn't work out, sure enough, animal research can help us to find a safe age at which anesthetics are safe to administer to our patients and beyond which we don't have to worry anymore. And initially, this seemed to be true when Vesna Jeftovic-Todorovic published her seminal study here, where she actually demonstrated that for cortex and thalamus, there seemed to be a window of vulnerability that peaked at 7 days of age, and then injury subsided in the animals, and once they got to 14 days of age, there was hardly any injury noticeable. So what that led people to believe is that when they combined this with these data from the 60s and 70s that looked at comparative changes in brain growth and then tried to figure out which is the comparable age to these 7-day-old rats to humans, they found that the peak of brain growth was highest around birth in humans and kind of tapered off at 3 years of age. And if you compared that to a rat, it peaked at 7 days of age and then tapered off. The scale down at the x-axis is actually in days for rats and years for humans. And so people believe that the 7-day-old rat is then comparable to the human brain around birth and up to 2 to 3 years of age. However, when you look at more contemporary work, you can actually see that the 7-day-old rodent is actually more comparable to a human from mid-gestation to birth. So does this mean that if in rodents cell death peaks at 7 days of age, that we then only have to worry about our colleagues that do fetal anesthesia, and in pediatric anesthesia we don't have to worry about this anymore? Well, this is unfortunately not really the case, because when we actually did studies where we looked further out, we confirmed the previous data for neocortex and caudoputamen, and also a part of the hippocampus, the CA1. And if you look at the left side of the column here, you see that in 7-day-old animals, that was the age where these brain regions were most vulnerable. And I'm showing here comparisons between control animals and anesthetized animals that received 1.5% isoflurane for 6 hours. And you can, for example, see that in retrospinal cortex there was about an 11-fold increase in neuronal cell death compared to the control animals. And that this quickly subsided, and at 21 days of age and 49 days of age, you couldn't even measure any significant increases in neuronal cell death in these regions. However, we were very surprised when we then looked at other brain regions that actually peaked in their vulnerability at 21 days of age. And some of these regions included the dentate gyrus, the cerebellum, and also the olfactory bulb, where you can see here that, for example, the dentate gyrus was exquisitely sensitive to anesthetic exposure at 21 days of age, which is demonstrated here by a 15-fold increase of neuronal cell death compared to 21-day-old mouse pups that were not exposed to the anesthetic and just fasted. So if the 7-day-old mouse or rodent pup is comparable to a preterm human, these contemporary studies suggest that the 21-day-old rodent is somewhere comparable to a toddler age or infant age human, whereas the 49-year-old is a toddler or a young child. So in some of these studies, it seems that actually if you would extrapolate these, that we've just increased the age range at which the human brain may be potentially vulnerable, because even in 49-day-old animals, we still found significant cell death in olfactory bulb and dentate gyrus. So some ongoing neurogenesis in these regions goes on beyond childhood. And in some of these regions, at least in rodents, and it's thought to be also be in humans, that neurogenesis is ongoing in these regions beyond childhood. So that didn't work out. So I think, you know, the final frontier here is the neurological domains. Surely enough, you know, animal research can show us, you know, what kind of domains we should look for. And Dr. Sun alluded to this in her introduction, that the epidemiological studies are somewhat puzzling in that, you know, certain studies have demonstrated an effect sometimes after a single exposure, sometimes after 2 or more exposures, whereas other studies have been negative. And there was a variety of tests that were used, from school records to group-administered tests, neurocognitive tests, or Bailey scales. And one always has to keep in mind, and I always, you know, caution people that it is very important to point out that all these epidemiological studies are retrospective in nature. So they can only show an association, but not a causation. They cannot tell us whether the outcome is due to the effect of anesthesia, pain, surgery, or the inflammatory response to the surgery. One reason why, and this is my hypothesis that I present to you here, one reason why these epidemiological studies may have found, some of them may have found positive results while others didn't, may actually be related to the fact that the exposure in all of these studies did not occur at exactly the same time point, at exactly the same age. It occurred somewhere in between newborn period to 4 years of age. And as I just presented to you, during this time period, animals are differentially affected by the anesthetic exposure at these time points. Different regions are vulnerable at different ages. So the same could be true in humans as well. And we have demonstrated this for neuronal cell death, and Dr. Laszlo Vuckic has presented this for propofol exposure, where in 10-day-old animals, a propofol exposure of 6 hours decreased neuronal and dendritic density, as you can see on the left-hand side here, whereas in 15-day-old animals, it actually increased neuronal density. So what my hypothesis is, what may be happening is, that it's very conceivable that anesthesia could actually have a very different effect even during this vulnerable period between birth and 3 to 4 years of age, when initially neuronal numbers are increased from the newborn period, from the newborn stage to 1 month of age, and then there's a rapid increase in synaptic connections, which are then later pruned into adulthood. And as you very well know, there's also very different skills between 0 and 4 years of age that the kids have to acquire, from newborns to infants that start working, toddlers, and up to school age. So I would think that during these sensitive periods, it's very plausible that anesthesia exposure could actually interfere with specific neurological skills that are learned during this time period. And that, for example, in the newborn period, anesthetic exposure might interfere with vision, hearing, and touch, as shown here in this graph, whereas in infancy, it could interfere with language development, whereas later on in life, it could interfere with higher cognition. And while you may say, well, maybe this is just a temporary exposure and maybe the kids can make up for it, there could be critical periods where certain skills are learned, and once the animal or the child is beyond that critical period, those skills cannot be made up. As seen here in Konrad Lorenz, who presented himself during the first few years of life to geese, and the geese then, took him as their mother and followed him throughout their life because they were imprinted on him during that critical period. So in summary, animal studies thus far have not clearly identified a particular anesthetic without any deleterious effects on the immature brain. And in fact, some of our studies suggest that at least the 3 inhaled anesthetics may be similarly injurious when they're administered in an equipotent dose. And anesthetics may predominantly affect different brain regions depending on the age during which the exposure occurs. And we have strong reason to believe that this may be because specific neurons, immature neurons, are specifically vulnerable to anesthetic exposure during a very small stage during their development, which is around 14 days of age in the neuronal life, when they're specifically vulnerable to anesthesia-induced cell death. Given the fact that these specific brain regions have been linked to the acquisition of specific neurological skills during specific times of development, anesthetic exposure during these periods may actually interfere with the acquisition of this skill. So maybe we have to look back at the data and figure out when did the anesthetic exposure occur and what kind of specific neurological skill was learned during that period and test for that period. I want to, keep it with Lao Tzu, though, who said, "Those who have knowledge don't predict. Those who predict don't have knowledge." So I don't want to predict anything here right now. I don't want to out myself as being without knowledge. And I thank you very much for your attention.